Hi, at the outset I would like to wish all the women a happy International Women's Day. This day, that is the 8th of March, we all celebrate as International Women's Day, and all of you know about it. So I just want to bring awareness among the women, because they're the center or the core of the family or the society or the community, where their health is so important to make a healthy society. So today I will be concentrating on one topic where it is a preventable disease, and at the same time the deaths are high because of the disease, and that is cervical cancer. So on this day, I just want everyone to know about the cervical disease, whether how you can prevent it, how you can take care of yourself, or what are the preventive methods and all that. So cervix, so most of you know, it is a part of the uterus. Uterus is a female organ situated at the lower abdomen, that is in the pelvis. So lower part of this cervix is known as, lower part of the uterus is known as the cervix. So this cervical cancer is very common in India. All over the world, but it is very common in India, and the deaths are more in India. Every year we record about 5 lakh new cases of cervical cancer. And it's about 18.6 cases per lakh women we do see every year. And the death is also 2.7 lakh women die every year because of cervical cancer. So that constitutes about 25% of the deaths all over the world. So you know the magnitude. So many cases, though we know it is preventable, though we know it is treatable, we are not able to do it because the awareness among the women is very, very less. So, and secondly, one is the cases, the demography, and the second is it is a preventable disease. If you are aware of it, definitely it can be eradicated. To that level, you can really try and do that. So coming to cervical cancer, so you want to know what it is, how the symptoms happen and all that. So cervical cancer, it's usually in the reproductive age, when you are sexually active, it starts. And some people will have white discharge maybe. And white discharge, again, you should know the normal difference between a normal white discharge and an abnormal white discharge. Not all, because I do see patients in my OPD coming with the fear, saying that she's got white discharge and they would have gone elsewhere, get their uterus removed for a normal white discharge. So anything just before their periods, 1 or 2 days prior to the periods, 1 or 2 days after the periods, and the mid-cycle, that is 15 days prior to their periods. That is the ovulation time, where the egg gets released from the ovary. That is the time they will have slightly excessive white discharge, which is very much normal. But at the same time, if they have anything foul smelling or itching in the vagina during throughout the cycle, if they have excessive white discharge, that is not normal. It need not always cancer. It may be because of some other infections also. But if it is associated with blood stain, then you definitely have to, even otherwise you have to see, but if it is blood stain, definitely you have to see your doctor. Again, blood stain white discharge need not be always cancer. It could be some other local causes like cervical erosion, polyp and things like that. But whatever it is, anything abnormal you feel, please do see your gynecologist. And then the post-coital bleeding, that's another symptom of cervical cancer. When you have a sexual intercourse, or when you have when you have a sexual intercourse, if there is bleeding from the vagina or blood-stained discharge, then again it is another important symptom of cervical cancer. Other than that, you can have intermenstrual bleeding, on and off, you may have bleeding or spotting. This again, it could be a cervical cancer. In all these cases, you need to go and see your doctor. So what are the causes? For this cervical cancer? So that is the multiple sexual partners. If a girl is having multiple sexual partners, she is more prone for cervical cancer. Secondly, at the age, the first sexual intercourse, if she is very young, say around 12 years, 13 years, 14 years, if they are sexually active, again they are more prone for cervical cancer. And multiple births, if they have given birth to many children, vaginal birth, many children, again they are more prone for cervical cancer. Any local infections, STDs, long-standing cervical infections, they are more prone for cervical cancer. So all this you should keep in mind, and mind you, just because you are having multiple children or multiple sexual partners, not all of them, but when you compare with the normal people, the incidence is more. So how you have to take care of yourself or prevent it? So it is, one is prevention, there are 3 stages. One is, we try to educate the people, bring awareness about the cervical cancer and prevention. And how to bring about that is because, screening methods and the vaccination. Screening method is the Pap Smear method. Pap Smear method and clinical examination also. At least once a year you need to go and see your doctor under good light. The cervical, examination, genital examination should be done. And secondly, the Pap Smear, that is a screening method. So Pap Smear, it is recommended annually for all women, which is done in Western country. They do it annually. In India, it is not mandatory. That's why the people, they don't come for Pap Smear. That is the reason the incidence is so high in our country. Pap Smear is a very simple outpatient procedure. We do it regularly. We do so many cases every day. There's nothing but we just take the smear or on the swab, we just take a white discharge from the cervix and smear it on the slide and see the cells under the microscope. Suppose if you are getting a cancer 10 years down the lane, then it can be detected now. That is the reason I said it is preventable. Even before it becomes cancer, you can detect it and get it treated medically. You may not undergo surgery, you may not undergo chemotherapy, radiotherapy, things like that. So Pap Smear is very, very important to prevent cervical cancer. And vaccination. Now we have vaccination, both bivalent and quadrivalent. And vaccination for girls, normally it is recommended even before they are sexually active, then first intercourse. Then it is more efficient, effective. That is why it is recommended from the age of 9 or 10 years, because now we know even teenage girls, they will be sexually active, so we want them to get immunized even before they are sexually active first dose. Then they require only 2 doses, one and first dose and 6 months the second dose. Or if they are already sexually active, then they will require 3 doses, 0, 1, 6, like that. They can take 3 doses of vaccination up to 46 years. Because why we don't give beyond 46 years is because there are no much studies to say that the incidence is less even when it's given after 46 years. So we recommend up to 46 years to take 3 doses of vaccination, this CS cervix vaccination. Or if it is taken in the adolescent age, then 2 doses are enough. Please keep it in mind, get your Pap Smear done, get your physical examination done routinely and regularly, and prevent this cervical cancer and bring down the burden on the society and also on your family. Thank you. Once again, wish you all a happy International Women's Day. Enjoy your day.